Hello, good afternoon, everyone, and welcome to Stop COVID Deaths. This is our 176th episode, and we just like to thank you for being part of our online community. Another year is coming to a close. I'd like to greet everyone. Um, Peace and blessings for Christmas and for the new year. Used to be that the word peace was just a word, but I think now we're beginning to understand and feel that we really all do want world peace. We all really do want to have peace inside ourselves because of all the many things that are happening around. But then, information is something that is valuable for us. It helps us deal with whatever challenges we face. And we hope that this past year we have been able to provide you with the information that has made you stronger and that makes you better as members of our health workforce. So, welcome to everyone, especially to those who have just discovered us today. Um, we are uh, we are very happy to be with you today. But I'm also going to say that for the Christmas break, this is going to be our last webinar. We're gonna miss you for a couple of weeks, but that's okay. We all need a little bit of rest, and I think all well deserved, especially for our frontline workers, wherever you are in the Philippines or in the world. Currently, we're witnessing an uptick in COVID-19 cases, according to the news. This resurgence is attributed to the highly transmissible Omicron subvariants. And of course, relaxed restrictions raises questions, and sometimes we have some health concerns. So, we're going to talk about that. Meanwhile, China grapples with a cluster of influenza like illness among children in its northern regions. We're going to hear about that. And what is the etiology, or what are the causes of um, this illness and illnesses in other respiratory illnesses in other parts of the world is something that we will discuss today. So, in this week's episode of Stop COVID Deaths, our esteemed panel of experts, and I assure you, you are getting the best experts today, very credible, well known public health practitioners. Have come to join us despite the busy season, and we are grateful for their presence. They will discuss the current caseload, vaccination rates, potential healthcare system pressures, and what's the effective way of not getting sick this holiday season. I think that's the key. So, I am Susie Pineda Mercado, and my partner Raymond, I don't know if he's in yet, is joining us a little late. Um, but we are always very happy to be here with you, and we hope, no, we know you're going to have a very, what should I say, a very pleasant and educational noontime break with us. So, um, is Raymond here already? Wala pa. Okay, no reply. All right. So, we are coming to you live through this webinar, and I'd like to thank all of you who are with us on Zoom. And I'd like to greet all of you who are watching TVUP YouTube channel, as well as the UP System Facebook page, the TVUP Facebook page, Stop COVID Deaths Facebook page, and of course, all of you are watching TVUP from TV channel 101. Okay, so we have really the best people to talk about the situation we're in right now. Not that you need to be worried about it, but I think we all want to have additional information about bakit nagkakatrangkaso, no? I think we had a wave of trangkaso here in our own house. No, first the kids got it and the adults had it, and I guess when I talk to other people, I realize they're going through the same thing. Is it trangkaso? Is it something else? We don't know. Anyway, we've got Dr. Eric Tayag, Undersecretary of the Department of Health. Dr. Ron Jean Solante, who is a practicing infectious disease specialist and is currently president of the Philippine College of Physicians. And from our local government, one of our favorites, Dr. Cristia Padolina, who is the city administrator of Navotas City. And for synthesis and closing, we have Dr. Joanne Karen S. Aguinaldo, who is the chief of the Division of Family Planning, Department of Obstetrics and Gynecology, at the UP PGH. As you have seen on our opening billboard, while we still call our program Stop COVID Deaths, we have been covering many different other topics. But today we're going to talk about COVID. We're going back to our roots, and we will talk about respiratory illness and what we can do to stay healthy during this Christmas season. All right. Now, I don't know if Raymond is here yet. Wala pa. Okay, paparamdam ba si Raymond? Okay, let's go to the news. I know that you're all eager to hear about the news both here and abroad, and it's for this reason that we are bringing you the news update. Okay, first in the news, the American Hospital Association has warned hospitals and health systems to look out for cyber criminals who may impersonate their executives through the use of what is called deep fakes. Deep fakes are synthetic forms of media that are created through artificial intelligence and machine learning programs to produce believable, realistic-looking but fake videos, pictures, and even audio. So voices can be mimicked. The warning piggybacked on a notice issued by the National Security Agencies of the United States about a rise in hackers using deepfakes to impersonate company executives to try to hurt their brands or to try to gain access to their different networks. When the American Hospital Association declined any request for further comments, the researchers reached out and tried to get opinions on this. And currently, there is a lot of dissemination about deepfakes or computer-generated images, video or audio recordings that never actually happened, but look or sound like it came from a real person. So they take multiple images, put it together, and can even make simulated videos that are fake. So this is something that we all need to watch out for, because could be very damaging for people if a deep fake video goes viral. Then it's all damage control after that. Okay, on our next news, is drinking ever good for heart health? All right, so I think Christmas season, people tend to make merry and sometimes take a little bit more than what they should take. And there have been articles about how a glass of red wine can improve your heart health. But what do we really know about alcohol and our health? A team of researchers studied the impact that alcohol consumption has on our metabolites, the small molecules produced through metabolic processes, and what the prevalence of certain metabolites mean in terms of the risk for cardiovascular disease. And scientists have found metabolic traces left behind after drinking that show higher cardiovascular risks, but there are also metabolites that are linked to lower cardiovascular risks. So I think there is really still the need to study this. Study findings were recently published in BMC Medicine, and the team of investigators led by biostatisticians from the Boston University School of Public Health used data from 2,428 people all over the age of 18 who had multiple in-person examinations over the course of 20 years. So it's a very robust study. Deepak Bhatt, who is the top cardiovascular expert from the Mount Sinai Hospital, New York City, has the same message for patients. He says that, people should not be misled by catchy headlines that sound promising for alcohol enthusiasts who are curious about their health. He says there's no question that alcohol is bad for your health in general. The real question is whether or not there is a sweet spot or a volume of alcohol that could be protective for heart disease, which is commonly believed. So this is the common belief that if you take a glass of wine, you're actually helping your heart. But what this study is saying is that the evidence for this is extremely weak. So we'll be back next week with more news for you on the news update. Okay, we are back. And we are looking forward to learning more about the COVID-19 situation in the country amidst a lot of influenza like illnesses that will be tackled by our speakers and that many people may seem to be experiencing. But before we go into that, TVUP has produced the interview of persons on the street. So we turn it over to you, TVUP.
Napapalitaan ko ngayon na marami ulit yung COVID, yung kaso ng COVID-19.
Ang narinig ko po ay nagkakaroon ng surge ulit kayong nakaraan lang.
Okay po, recently I heard from the news na ang Quezon City, they implemented again wearing of face mask because of the increasing number of COVID patients.
So recently, nabalitaan ko nga na tumataas yung kaso ng COVID-19 sa bansa.
Dumadami yung kaso ng COVID-19. However, hindi siya masyadong binibigyang pansin ng mga karamihan dahil siguro back to normal na tayo at hindi na rin ganun karami ang mga warnings na binibigay ng government.
Oo, nagkasakit ako, pero mild lang naman nitong June. Nagkasakit ako, nilagnat.
Someone I know who had COVID recently is one of my bosses. Okay, but don't tell anyone. Okay, anyway, so a week ago, he got COVID-19.
Ako ay nag-positive sa COVID for the first time since the pandemic. And to be honest, I had a mild anxiety attack kasi medyo nakalimutan ko na kung ano yung mga dapat gawin na pag-alaga sa sarili when you have COVID-19.
I'm thankful na wala naman sa mga closest ko na nagkaroon ng COVID. However, feeling ko may mga nakilala ko, may mga kaklase or mga katrabaho ako nagkaroon, hindi lang siguro sila aware or kami aware dahil nga yun sa sinasabi ko kanina na hindi na masyadong mahigpit at masyado na tayong parang nabulag sa back to normal kaya hindi na rin nabibigyan pansin yung mga symptoms.
Kahit hindi na mandatory yung paggamit ng mask, gumagamit pa din ako. Lalo na sa mga enclosed places, maraming mga tao. And then yung proper hand washing.
Ngayon po ay bumabalik na po kami sa masking, lalo na po sa school ko po dahil malapit po kami sa PGH.
To protect ourselves para dun sa COVID is nililimit namin yung paglabas doon sa mga crowded places, no? In case, depende na lang kung kailangan talagang pumunta doon. And then we also continue sanitizing yung hygiene and then washing of hands, and then pag umuuwi ay ganun din, naliligo pa rin at nagugas ng kamay and others.
So, I'd be very honest, hindi ko naprotektahan masyado yung sarili ko. I think medyo naging lax na din yung mga tao. Some people who are even experiencing symptoms ay hindi na nagtitest. And dahil very flu-like na yung symptoms, siguro yung iba ay nag-a-assume na regular flu na lang din yung nararamdaman nila.
The way na para hindi tayo matakot doon sa COVID-19, kailangan din i-protect natin yung sarili. So tuloy pa din maging malusog tayo, kumain ng dapat na kainin para tayo ay maging malusog. At saka, ayun, kung kaya din lang naman ay siyempre maglagay ng o gumamit ng mask, lalo na doon sa mga confined places.
Siguro it's very important na may COVID man or wala is yung paglilinis, tamang pagbahing, o kaya naman po ay paghugas ng kamay, yung paglalagay ng alcohol.
Siguro kakayanin ng katawan ko, pero paano pag nakahawa ako ng isang tao na high risk or vulnerable? So, at this point in time, let's not just think about ourselves, but other people who will contract COVID-19 because it's still very contagious.
Okay, thank you so much, TVUP. And really very interesting to hear how ordinary people are looking at what's happening around them, and to hear what they've learned. A lot are going back on the lessons. And I think this gives us a good takeoff point for our discussions today. Okay. So I have some housekeeping for you. We have certificates of attendance, and they will be given to those who had watched at least 50% of the webinar duration. So, okay, let's go. So, actually, Raymond is not yet here because he's a speaker somewhere. So, gumaganti siya kasi last week medyo nakaalis ako ng maaga. I'm joking. Anyway, okay, let's proceed to our topic at hand. And for our webinar today, we have a standard panel discussion that will be followed by Q&A if we have enough time. In the meantime, while our speakers are speaking, please feel free to use the Q&A box for any questions that you have. Okay, so before we go into the webinar proper, we have a fun quiz. And we have a bit of an intro for the fun quiz. So turning it over to you, TVUP.
Hello? Hello? Hello?
Kumusta na kayong lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, thank you, TVUP. That's very cute. I was actually contemplating wearing a Santa hat today. But yeah, thank you so much, TVUP. So let's go to our fun quiz. And I'd like everyone to take a few moments. Whether you're on Zoom or you want to use the Slido mechanism, we have 2 questions. And what you need to do for Slido is open your browser and go to, ano nga ba? Hindi ko makita. Okay, slido.com, number 6510096. Or you just enter the quiz on your default on the webinar screen. Okay, 2 questions. First, let's go to the first question. ILI, ILI stands for increased liquid intake, influenza-like illness, invasive-like illness, or none of the above. Again, influenza-like illness, increased liquid intake, invasive-like illness, or none of the above. So while you're filling that up, I'd just like to thank all of you who are watching all around the country and those who are watching from abroad, and just give a couple of tips for the holiday season. I think Christmas and New Year, this holiday season can be very stressful. And with the traffic, I hope you don't get too stressed out. So the thing to do is to have a plan and to stick to it, okay? Stick to your plan. Don't take on additional appointments. And don't go too far away from where you live, because we all know how difficult it is to commute. A second tip I would give is keep your handa very simple. And make sure that the handa has, vegetables, healthy drinks like water or fresh juices that you don't add sugar to. And maybe a third tip would be sleep well. Don't stay up late all night partying. I think, we like to binge on everything, including making puyat during the holiday season. So, just a few reminders from us for the Christmas season. Okay, let's go to our second question. Number 2. Which of the following are recommended for households with flu patients? A, increase fluid intake. B, wear a mask. C, hand washing. D, all of the above? Again, which of the following are recommended for households with flu patients? 1A, increase fluid intake. B, wear a mask. C, hand washing. And D, all of the above. Okay, so while you're filling that up, again, a few more tips for the Christmas season. I think we talked about alcohol earlier. If you do drink, please do not drive. I think, nowadays we take it for granted, and we think, okay, just a little alcohol won't affect us. But if you're going to drive home, then you be the designated driver who does not take any alcohol at all. I'd like to also remind folks to drink a lot of water during the holiday season, 8 to 12 glasses of water a day. Don't get dehydrated, because this is a Christmas season that's not really very hot, but it's humid. And you could not really very cold, I mean, but it's humid, and so you could find yourself dehydrated, particularly if you drink alcohol. And finally, a last little tip for the Christmas season, for those who are from not in the Philippines right now, but missing your family and so on. Reach out, write letters. I think for those who are in the country, sometimes quiet time at home is a good thing for Christmas, and it's not all about parties, and it's not all about giving expensive gifts, but it's about being thoughtful and really imbibing the spirit of Christmas, which was our Lord's gift to us, which is the Savior Jesus Christ. All right, here we go. Now we are going to as we leave our poll, we're now going to our main presenter. And I know you're looking forward to this. Everyone looks forward to listening to him or seeing him dance. So we have our Undersecretary of the Department of Health, Dr. Eric Tayag. Eric, welcome to the webinar.
Thank you, Susie. Merry Christmas. And I'm going to ask permission to dance.
Yes, please.
Okay. Nice to be back.
Thank you, Eric.
This,
Thank you. I know you're
stop
very busy.
COVID. Yeah. I can't say no.
Eric, the audience is always waiting for you. Sige, go. Take it away. Take it away.
Okay. Before I start, I'd like to offer a minute of silence for the departed, our former Secretary of Health, Dr. Felipe Estrella Jr. We just got news today that he died, and we offer this prayer to his bereaved family. Maraming salamat po. Okay, thank you. Nandiyan na ba yung slides?
Yep, it's up, Eric. And thank you for that
Okay.
moment
Okay.
of silence. Thank you.
Okay. Naka-slide view na ba? Okay.
It is, but I don't know if this is your opening slide or your ending slide.
Yeah, this is my start.
Okay. It's full.
Okay.
Full screen.
Kaya start yan kasi Susie, ganito mangyayari ha. Pre-press ko na.
Sige.
Ayan. Cortina. Okay.
Kaya pala sabi ko, ending slide yan, yung pala merong reveal. Okay.
Yes.
Okay.
Dun sa mga sumali sa amin na umabot na sa 141. May trangkaso ka ba? Okay, today we're going to talk about influenza-like illnesses, COVID-19, and walking pneumonia. Is there much hype sa walking pneumonia? We'll find out. In the news, Sun left, that's how the situation in China, when in late November, there were reports in the news of a mysterious pneumonia illness in China, affecting mostly children. Many were hospitalized, and even deaths were even reported. And then shortly after several weeks, when WHO urged China to provide more details, other countries also reported, among others, Mycoplasma pneumoniae or the walking pneumonia that was reported by Chinese health authorities as among those viruses or pathogens they have isolated from the cases that were reported earlier in November. Over at the right, we show you the COVID-19 new hospital admissions comparing December of 2022 to December 2023. There's been an uptake in the United States. That's the report from the United States. And the question, do we have a similar situation in the country right now or in the next few weeks? First of all, in the first part of my presentation, we'd like to impress upon you exactly how the Department of Health gathers all information related to those, among others, that I have mentioned just now. So, this is based on the principle that what gets reported are responded to. These are responded to because we have a commitment to the international health regulations, as well as all offices that will implement their respective responses. So I introduce to you the Philippine Integrated Disease Surveillance Response, composed primarily of an epidemic-prone disease case surveillance and a complementary event-based surveillance and response. We expect that disease reporting units will report on a regular basis so that epidemiology and surveillance units can consolidate their report on a weekly basis. And within 2 weeks, we are able to report to you straight from the Epidemiology Bureau of the Department of Health. There are enabling laws, including the law on notifiable diseases and several department memoranda that allow us to collect information via procedures that are standard practice and that which would make it easier for local government units to follow and regularly report and notify a list of diseases, conditions, or even syndromes to the Department of Health. But what's the difference between event-based surveillance and case-based surveillance? Case-based surveillance are about human cases, while we collect, analyze, and interpret data collected from each human case. It is limited, however, to those that are categorized as notifiable or even those that are epidemic prone. For events-based surveillance, the reason it complements case-based surveillance because not everything will be in the list. And so the event-based surveillance allows us to get information from non-traditional sources like media, local government units in their information highway, even from non-government organizations, and even from you. But the important thing is these are reported on a timely basis. For example, did you know, as part of the event-based surveillance, that we have several signals so that the schools can actually report to ESUS. ESUS stands for Epidemiology and Surveillance Units. So if there are 2 or more students in a class or section or school employees even, and within 7 days, could have any of the following influenza-like illness. Here we define as the presence of fever and cough, or even cold or sore throat. Respiratory illness would include difficulty of breathing, fever and rash, blisters on hand, foot, and mouth, and others that can cause headache or any changes in mental status, sensorium, seizures, neck stiffness, and or other neurological signs or symptoms, as well as the others we have listed on the screen. In the case-based surveillance for COVID-19, for example, the Department of Health in other countries have adopted the case definitions provided with the World Health Organization. There are suspected cases, probable cases, and confirmed cases. Since the pandemic, and because of the likelihood that this will be followed by another pandemic, we have enhanced our surveillance for influenza through our influenza-like illness surveillance. This is a type of a syndromic surveillance. That's why there was a question, and in fact, we're piloting the integration of ILI, influenza-like illness, SARI, severe acute respiratory infection, or your pneumonia, and COVID-19. The strategy is to make sure we capture COVID-19 and ILI on a timely basis using the most available technology and tools that are currently within our capacity. Please take note that even animal surveillance, for example, for bird influenza, will complement our existing strategies. So now the Department of Health is working on a pan-respiratory illness surveillance, not only limited to COVID-19 or influenza, and will include other pathogens as well, notably the respiratory syncytial virus, for which we have vaccines available to protect populations that may be affected. Flash report. How's the influenza-like illness situation in the country right now? Over on the left, we show you that since the start of the year, there has been an increase in the number of cases reported. In fact, the total number of cases has reached almost 200,000, and this is 50% higher than 2022. The case fatality rate remains very low. Children comprise 38%, and these are children under 5 years old. We list the top 5 regions in which we have seen an increase in the number of cases. COVID-19. The average daily cases reported right now is at 260 compared to less than 200 in the previous weeks. We have an ICU utilization for 13.5%, and this relates to severe or critical cases. We also track the bed utilization, which is at 16% for the whole country. Since the start of the pandemic, we have a cumulative 4,127,586 confirmed COVID-19 cases. Many are asking, should we wear our masks again? We have different layers of protection. We know the drill. It's not only a rehearsal, we actually made this into a habit. And so while there is no mask mandate right now, those at risk and vulnerable populations of COVID, like elderly patients or pregnant women, can be our models for making sure that masks are worn in enclosed spaces, overcrowded places, and even while in public transport. Now, many worry about hospital costs. While we say that the COVID vaccine, for example, can prevent hospitalization, there are other respiratory pathogens that can cause a visit to the hospital. Right now, the PhilHealth has raised the package rate to over 90,000 pesos. Now you say that you will just take antibiotics for Streptococcus pneumoniae. We're good. Many of the drugs listed here can still work. How about Haemophilus influenzae B? Yes, antibiotics still good. And this is to show you that the Department of Health, through the RITM, since 1988, has a surveillance system to track antimicrobial resistance. I hope you have completed your COVID-19 primary series booster doses, including the bivalent version, so that you will be protected with the strains coming out of the Omicron lineage. Influenza vaccination for senior citizens, as well as to those 18 above with specific medical conditions, are available right now. But take note, because flu vaccines should be given every year, and that we're almost close to ending 2023, you have to hurry up because new vaccines will be needed by next year. Pneumococcal conjugate vaccines are given to children less than 5 years old, especially during the first year up to 15 months. For the adults, we have newer pneumococcal conjugate vaccines, as well as the vaccines that are routinely given on a 2-interval dose. But please don't forget that measles also causes pneumonia, and we have to protect our children against measles. There are some or several outbreaks happening right now. This is the season for measles, and although we have reached 80% in our measles, rubella, supplemental immunization campaign, we still have pockets of children that remain unprotected against measles. Exactly how do we do if we have outbreaks of influenza? We're looking out for bird influenza as well as new influenza strains. And so therefore in schools, we made sure the Department of Education or even CHED can swiftly shift to distance learning when this is required. Just recently, walking pneumonia was in the news, especially when the Department of Health reported at least 4 cases of Mycoplasma pneumoniae in our influenza-like illness surveillance. This is just to take note of the fact that Mycoplasma pneumoniae is not a new pathogen. Why only 4 cases? Because it is not routinely tested. And Dr. Jean Solanta, who follows my presentation, will give you more details about Mycoplasma pneumoniae. You can still travel, but of course, attendant to travel is the risk of getting any of this influenza-like illness or passing it to other people. So may trangkaso ka ba? Huwag, mataranta. Maraming salamat po. Magandang hapon.
Thank you so much. Eric, palakpakan naman natin yun. Very, very, very clear. I think for me, I really appreciate this presentation, and you will see the hearts and I don't know, clapping hands, the emoticons coming out. And we're looking forward to having you, Eric, for our Q&A. Or do you have to leave early? No.
I don't have to leave early.
Okay, very good. All right. So I'm sure there are some questions, and there are already some questions in the Q&A box. But let's leave that first. Huwag niyo munang sagutin yung mga Q&A box. We'll take them up.
May mga mahirap na questions doon.
I know. I saw.
Oo, talagang nakaka-nervous sagutin.
Oo, talaga naman. Kaya ka nandyan kasi kailangan yung mga mahihirap magagaling ang sasagot. Okay, let's go. Our next speaker, also one of the favorites of Stop COVID Deaths, who was with us from the very, very start when he was in San Lazaro, president of the Philippine College of Physicians. Please all welcome Dr. Ron Jean or Jean Solante. Jean, welcome back to Stop COVID Deaths.
Hi, Ma'am Susie. Good afternoon to our viewers also, no? And again, thank you for inviting me again to give you some updates also on COVID-19 and acknowledge also the data that was presented by Sir Eric regarding our local prevalence of COVID and other influenza-like illness. Actually, my focus for this topic will be more on the COVID-19, and I'll discuss latter part will be COVID vaccine. Do we need it? And if we need it, are there specific population that we will have to target? So this is just a global overview of the COVID-19, and as of November this year, there are 772 million confirmed cases and quite a lot of death, no? Causing around 6 million deaths globally. But if you look at the trend in the different WHO regions that's reported by this epidemiological update, it seems that a lot of those regions are reporting a decrease in the number of new cases, including the number of deaths. But again, when you look at the 2,400 new deaths in the last 28 days, that's still something that we need to deal with, no? Because if these are, if we're dealing with the COVID-19, and we always thought that it's like also an influenza-like illness, but having this 2,400 new deaths, then that tells a lot that we have to still be watchful about COVID, because it doesn't mean that all of those patients who will have COVID will remain just like a mild type of influenza-like illness. And in fact, as I've stated in the previous slide, the deaths are really decreasing by 72%. But some regions like in Europe and in Western Pacific, there are still countries reporting some of this mortality, whether it's directly related to a COVID-19 infection due to a respiratory complication, or could be due to also the comorbidities related with being unstable, and it's being triggered by COVID-19. Now, we've learned a lot of several indicators of response to COVID-19, wherein we need to prepare the hospital facilities, and also an indicator that we need to raise the alarm in terms of restriction And currently, there are two very important indicators of severity of this COVID pandemic. And these are the ICU to hospitalization ratio and the death to hospitalization ratio. So where are we now? No? So compared to the previous years, like in 2021, wherein we have that highest peak of the ICU to hospitalization ratio, meaning there were more admitted. So the proportion of those hospitalized and went to the ICU is high. And compared to 2021, our hospital ICU to hospitalization ratio has significantly gone down, no? And working on the area between 0.05 to 0.07, which is really a very acceptable and not so alarming. More so that we want to also would like to look at that the present COVID-19 circulating variants of concern or interest. Is it still dangerous? Is it still causing more serious or severe form of pneumonia? Then the current death to hospitalization rate, meaning those who were hospitalized and how many died because of COVID, it's also going down at 0.06 to 0.14. So overall, there is now an associated lower mortality risk among those who were hospitalized with COVID-19. And that is also what we have experienced in most government hospitals, like San Lazaro Hospital. We still do see some of these COVID-19 patients in our ICU, but glad that we have passed that stage that when we see them 3 or 4 days after or 5 days after they became severe, a lot of them initially will present with difficulty of breathing, decrease in the O2 saturation, but they recovered, no? A lot, no? A lot more, majority of them, and that's why it also tells that speaks a lot of the low severity of the current COVID-19. Now, we want to focus also are what is now the current circulating variants of concern or variants of interest. No? So this is the evolution of the Omicron subvariants that we experienced starting in 2022 and until now. So several lineages based on several evolution of mutations resulted in different lineages. And I think the most dominant now is the XBB variant of concern, which has been circulating for almost 2 years now. And some scientists would like to define this as an evolutionary wonder. Why? Because of its ability to be dominant, to be remaining in circulation, and evolving further to infect vulnerable population, to the point that with several mutations now, we are left with what? 4 variants of interest. You have the XBB 0.1, 0.5, the XBB 0.1, 0.16, and then the EG 0.5 and the BA 2.86. Okay, and the WHO is also monitoring some of these variants under monitoring, no, or the VUM. Probably, if you'll ask me what is VUI and what is VOC, VOI, there are 3 criteria for us to say that this is a variant of concern, meaning there is related with severity of the infection. There is also reduced effectiveness of the vaccine and the ability to compromise healthcare facility. Since all of these variants are not yet able to compromise the healthcare facility, and there is no concrete data that it can also cause severe COVID, then that's why there are variants of interest. Now, globally, there is what we call this dominant variant now, continuing to be the most prevalent variant of interest, reported in 89 countries, and this is the EG.5. Okay, if you look at the XBB 0.1, 0.5, and the XBB 0.1, 0.6, there is now decreasing trend, no, in most countries, and the trend is quite stable. In some regions, like Western Pacific region, they're also monitoring the variants under monitoring, the DV.7. All of these are under the XBB lineages. No? So just to give you more information, if you look at the arrows here, these are the different region, WHO regions, and the yellow one are indicators that EG.5 is really increasing in some regions, like Western Pacific region, where the Philippines belong. You have the European region, including the American region. So, meaning if there is a variant of interest that we should be worry about, this could be the EG.5 because the other variants of concern are already decreased in trend. Now, they also released this risk evaluation of how does this EG.5 behave in terms of three very important indicators of the severity or how it will affect our healthcare system. One is the growth advantage, and they found out that there are mutations in this EG.5 that really looks like your XBB, highly transmissible, and that's why the growth advantage has been documented in most countries. Why is it increasing in some countries? Thus, the level of risk here is very high. But in terms of the ability to reduce our effectiveness of vaccine, it's moderate. But again, more important for us is that its ability to cause more severe COVID is really low. And currently, there are no reports yet correlating that EG.5 can increase disease severity. So the overall risk evaluation of this new variant of interest, the EG.5, is low. In the Philippines, if you ask me if we have documented the EG.5, yes, we have, and I think that was in this was in September. This one, okay, and after that, the dominant variant. This is coming from the Philippine Genome Center. Majority is the XBB.2.3 as the most detected among the different XBB sublineages, and then this is followed by the XBB.1.16. No, but since there are only very small samples that has been examined because of the few numbers of tests that samples that has been submitted, then it's not far-fetched that we may be under-reporting also the accurate status of our variants of interest, and it doesn't mean that we don't have the EG.5. Okay, so these are some of the data coming from these hospitals, RITM, Southern Philippines Medical Center in Davao, and that of the UPPGC. Okay, so the dominant variant is still the XBB.2.3, followed by your XBB.1.5, then you have 0.1, 0.16, and the 0.1, 0.9.1, which is the mother lineage of the EG.5. Okay. Now, Dr. Eric mentioned this one, but I would just like to reiterate again that ILI cases is not new in the Philippines. Okay, and that's the reason why that we have to thank DOH for a very good surveillance. Ever since before the pandemic, if you look at how the trend of ILI cases in the Philippines, beginning September, October, November, December, and early part of January, that's usually the peak of the ILI illness. No? And in fact, if you look at the FluNet also, which I will show you later, okay, that will also be the reason why that when we are advocating for influenza vaccine as much as possible, we should be starting our influenza vaccine during the second quarter of the year to prepare for the peak of cases, which will start September, October, November, December, which was totally different when we had that Southern Hemisphere recommendation in the past that the peak of influenza in the Philippines was August, September, October. Now it's beginning to be late part of the year. And we are experiencing that even before the pandemic occurred. And it's likely that that will be the trend in the next few years. And based also on this surveillance by the Department of Health, as reported by Dr. Eric, the pan-surveillance of respiratory tract pathogens, it seems that these are the major causes of the ILI. And part of that is also COVID-19. So we have to think of it that COVID-19 is now part of an ILI. There is still influenza A, there's still influenza B, you have your para-influenza. And then, of course, lately with the Department of Health has already detected the presence of respiratory syncytial viruses that also been circulating. And I think Dr. Eric mentioned the importance of vaccines that will really prevent the increase in the cases and more or less the role of these vaccines in terms of preventing also severe infection for the vulnerable population. So this is what I would like to to emphasize here that in 2023, okay, you look at the different influenza subtypes. Okay, we have two circulating influenza A, your H3, the H1N1, and we have a single circulation of your influenza B, which is the Victoria lineage. No, and I think still the most common is your influenza A, followed by your influenza B and some of the influenza A. So the question then is, does our current flu vaccine covers for these three subtypes of your influenza? Yes, it covers the three, no, because we are using the quadrivalent additional influenza B Yamagata strain, which is part of our vaccine, flu vaccine formulation. So you see here the trend that increasing cases starts in September, October, and I think this is also expected, which has been occurring the past years, even before the pandemic. Now, there are still questions. Do we need a COVID-19 vaccine? With the circulation of variant of interest totally different now from the previous year, there are also questions, does the bivalent vaccine will still work? Part of the WHO recommendation from the shifting of an emergency response, treating COVID as a long-term COVID-19 disease, you'll see here that vaccination will still be part of that, and it will now be integrated into the life course vaccination program. Okay, so that will be the direction, no, in terms of when you will be recommending vaccines. In fact, in their recommendation last May, because of the persistent circulation of the XBB lineages, which is now the predominant circulating vaccine variant of concern, wherein most of the sub-lineages are also under this one, then they aim to change the recommendation from a bivalent to a monovalent XBB.1 descendant lineage type of vaccine, if it is available. Okay, and they further give this consideration for a country. Like, for example, when you will be putting a vaccination program, which is always the case, you need to know the high-risk population that will be vulnerable, that for them to be infected with these new variants of interest, if they will develop the severe infection. Second is that if we have data to tell us that this current circulation of your variant of interest is also causing a burden of our compromise of our healthcare facility because of severe COVID. And then I think the most important here is it available in your country? If the government has allocated some of this new vaccine, then we have to look at it that only those who are priority population that will develop the more severe form of COVID should receive this. And in fact, that has been stipulated in this WHO recommendation that for an Omicron specific vaccine, then these are the high priority population that should be given. You have the older adults, you have the younger adults with significant comorbidities or severe obesity, or the subgroup of older adults, wherein you have also a significant comorbidity, especially those who are immunocompromised. So, meaning don't expect that if the government will really procure, or if there will be availability of this new vaccine, then it is not really for the general population, but probably focus on this vulnerable and high-risk population. So my conclusion here is that with the new COVID-19 variant of interest still causing new infections and hospitalizations in some countries, I think the more accurate measure here is because of the co-circulation of other viruses, and this is what's causing also the increase in the cases. So meaning it's not only COVID we're dealing with, and that's why it is expected that ILI numbers will also be increasing because of the co-circulation of other viruses, including the atypical organism we call the walking pneumonia or Mycoplasma pneumoniae. Okay, and if ever there will be recommendation for a COVID-19 vaccination, a variant specific, then this will be focused on a priority population that will have a higher risk of hospitalization or development of complications because of COVID, such as the long COVID complications. So we like to emphasize again the importance of vaccination, not only against COVID, and Dr. Eric mentioned this, the pneumococcal vaccine, the influenza vaccine, and the soon to be available, the RSV vaccine. These are really part of a layer of protection that our population can avail, and hopefully will have impact also on the vulnerable population to decrease the risk of severe COVID. And I would like to really appreciate how the Department of Health is building up and expanding the surveillance system now in terms of detection of different organisms causing influenza-like illness, which is really key in terms of the prevention of outbreaks. So with that, I'll stop here, and thank you very much for your kind attention.
Wow, thank you so much, Jean Solante there. And again, this is one of those presentations that you want to watch again and look at. Thank you for all the time you put into preparing the slides and everything. Very, very clear. Again, I know our audience really appreciates all of the information that you've shared with us today and given us some things to think about. So we'll talk about that in our Q&A. And partner is already here. Raymond, lonely na ako kanina pa.
Good afternoon. Good afternoon.
Naman, iniwanan mo ako. O ano, okay na? You finished
Okay na
your
po.
engagement?
Yes,
Great.
yes, yes. You just finished po.
Yeah. You
Thank
want
you so
to
much.
introduce our reactor? Go ahead.
Yes, for before I introduce po, no, so everyone, if you have any questions, just feel free to put them in the Q&A box, or if you're outside of the Zoom, you can put them in the comment section of the YouTube channel po, or in our Facebook pages. Okay, so we will be scanning them, scouring them, and choosing which ones will be the most voted for, which ones are the most interesting. Okay, and for our final speaker for today, she's hindi na po siya kaila sa inyo, and one of your favorites po, especially when we're talking about from the local government perspective. She will be our reactor. She has a new title, City Administrator for Navotas City po, Dr. Kristia Padalina. Ma'am Kristia, go ahead po.
Yeah, good. Thank you, Raymond, for that introduction. And as always, I am glad to be here with our mga suki sa audience. Okay. So let me just have this as a slide. Okay. Nung binanggit ni Dr. Eric Tayag, trangkaso. Pag sinabi mo kasi sa common tao, trangkaso, some of them would just be able to relegate this to the background. You just need to sweat it out, rest, and that's it. But since we're coming off from the pandemic, we need to be assured of several things. One, LGU cannot rest right now in terms of information. So we need to be sure that we are conveying the right information without putting people in quote-unquote panic side, but to make sure that they are protected and safe also. So this delicate balance, we try to negotiate by ensuring that every week we still continue with our FB streaming, and also with some TikToks we just modified because of the differences already in relaxed mode in terms of the COVID. But definitely we still provide them with the necessary information so that when they ask, we're giving them the right information. And it's quite important that especially during Christmas, we assure them that yes, it's okay to celebrate, but then we should also take care of our vulnerable population. So these are posted, and most of the LGU would have the same approach. Right information, connected with the community, we address their concern, we still continue with the telemedicine, we still continue with addressing their concerns, because going to the path of universal healthcare law, we also need to be ensured that we go on the path of wellness. We see them not only when they are sick, we see them across the lifespan, whether they're sick or not, but with emphasis on preventive and promotive health. So in terms of having masks, yes, we are encouraging them, especially in the congested area, and we're also encouraging the vulnerable population to be engaged on this. So taking it off from the discussion of Dr. Eric, we hope we were able to build over time the information dissemination and encourage most of the population to have the vaccine so that at this vulnerable time, we are able now to address the issue. Now, since we have a lot of information and I appreciate the report provided by Dr. Solante, we need to tell them also that yes, this is flu, this is a variant maybe of the COVID or the influenza-like illnesses. We still continue and provide service at our local health center. Two-pronged, both the vaccination, but none of the COVID, but surely of the other vaccines that are needed on the vulnerable population. And two, we also ensure that the tests are available because the spike that we're seeing right now are more of family, simply because they just think it's a common cold. So the first step really on a practical point of view is to ensure that it's not COVID. So we still make the tests available. Now, if you've read the news that Quezon City has changed its alert level, it's because we think that most of the hospitals are in Quezon City and therefore reporting and surveillance is quite good on that area. We still emphasize on the basics for fighting flu, and I think an ounce of prevention still is worth a pound of cure. So therefore, our approach is still for the community to ensure that they have the necessary basics to safeguard against this. Okay, and yes, I agree. We are now seeing admissions, which is the usual case for December and January. But I think what is important here is on the early stage, they seek consult so that we avoid getting the ICU cases and we handle them appropriately rather than having them seen at a later stage and they are now admissible to ICU. So I'd like to think that in terms of the community, the approach is one, we have already inculcated with them the value of prevention in terms of wearing mask. And we do not see as much, but when we go to elevators, when we go to congested areas, they wear mask. But I do appreciate and think that individually, it should still be us protecting ourselves first. We don't want to further compromise our healthcare workers in terms of, especially right now, that there are increases or a change in health-seeking behavior of the community, and therefore, there should be consistency on how the healthcare provider approach the issue. And I think the best information should really be coming from the healthcare provider. So thank you very much. And I do hope we will be able to answer most of the questions during the Q&A. Thank you. Thank you, Dr. Raymond, and thank you, Dr. Susan.
Thank you. Okay, Raymond, take it away. Ano bang next natin? Okay. We're gonna have a short break.
Short break, Dr. Susie. So while our speakers po are switching on their videos in preparation for a Q&A session, we'll take a very quick break for a special public service announcement today.
O sige na anak, parang kagat lang ng langgam. Hantik o yung kumikiliti lang. Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ko rin po ang color nito. Pero ayoko po ng red hantik. Masakit kumagat at takot rin po ako sa blood. Magtudugo po ba ako sa bakuna?
Hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Dok.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Dok.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Colorin yan for love.
Thank you, Doc. Thank you, Nay. Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center.
Thank you so much, DVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the webinar team to push for vaccinations po against COVID-19. So, we encourage everyone to share this video clip in all their social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, first question, Dr. Susie.
Yeah, okay. So we'd like to ask our guests to open their videos, and now we start our panel discussion. I want to pick up from what Dr. Christia mentioned, which is I think we heard some general recommendations from the public, which I think we'll be summarizing as we go along. But right now, should our hospital administrators and health center, district center chiefs be thinking a little bit more about environmental measures and maybe personal protective equipment for during the season where we're seeing an uptick? Or are we doing extraordinary vaccination for our healthcare workers? Because this is going to be an evolving situation. We know that. And again, Raymond, when I think about what happened at the start of COVID, which we very well documented through this webinar series, it was really the first line of defense that needed the most support. But not now. We don't have a crazy virus right now, but still, health workers go home to their families, will be interacting with others, and so on. So what's the thinking around extra measures that we need for our hospital workers, health center workers, and the like? So anyone can start.
Okay, thank you, Susie. Let me start.
Okay, go ahead.
Very
Eric.
good shape, because what we learned in this pandemic is being put forward. In fact, in the just recently concluded public hospital the association, we were able to, the Philippine Hospital Association, we were able to provide recognition of hospitals that have actually enhanced their infection prevention and control practices. And I'm happy to share with you that many hospitals actually stepped up their practices in preventing hospital-acquired infections that includes COVID-19. In fact, making sure that hospital personnel will get their primary series boosters against COVID-19 completed. And so the risk is low for many health workers, because we are very happy with the results of the vaccination among this targeted population. But of course, we lag behind in terms of senior residents getting the needed boosters, and also a double whammy, which should not happen, against influenza. That's why I'm taking this platform to make sure that we urge our elders, our senior citizens, to get their free vaccines before the year ends. Over to you, Susie.
Thank you very much, Eric. Jean, what are your thoughts on this?
Yeah, thank you for that comment, no, an opinion, because I think the realization here is that what in our experience for the past 3 years with the COVID pandemic, the importance of our healthcare workers, and one of the challenge now is the exodus of some healthcare workers, no, to other countries because of the low salary and other things, no? But again, that's beside the point. The point here is that most hospitals now, especially the tertiary and the secondary hospitals, are always on alert in terms of these respiratory tract infections. In fact, most of us, if I'm going to relate our experience here in San Lazaro Hospital, we will always do some stockpiling of the PPEs, which is quite very crucial. Even during the time that when the president lifted the public health emergency, we did not our budget, our allocation for PPE remained at a high alert also, no. And then I think we have to address also the importance of compliance to the healthcare vaccination program, which I think which is very lacking. If you look at some of the hospitals, ang baba ng influenza vaccination rate, ang baba ng pneumococcal vaccination rate, no? And there's still some element of hesitancy despite our good success with COVID-19. So saan tayo, we have to put in those gaps. Saan ba, paano natin mapalakas ang vaccination program sa healthcare workers? And like for example, sa private hospitals, mababa dahil it's an out-of-pocket expenses, no? So dapat hindi, no? Kasi serbisyo na yan sa hospital, why not give it for free? So government naman, limited din ang mga supply dahil we always are dependent kung ilan lang ang doses na ibibigay sa Department of Health, no? So there are issues really on accessibility, no, equity of this vaccine that I think hopefully the government should also address and prioritize the healthcare workers.
Thank you so much, Jean.
Yes,
Christian,
Susie.
go
Yeah,
ahead.
let me take it off from the discussion of Dr. Solante. We really need to ensure that vaccines are accessible and available. Now, most of the LGU right now depend on the Department of Health on the number of vaccines. But based on previous experience we're in, it is really not enough. We maximize on different kinds of budgets, specifically that of GAD budget or Gender and Development budget, to augment further the number of vaccines. But on the standpoint of the LGU, most of the problem is really the acceptability. Most of the senior citizens, the vaccines are available, but not all of them are trooping to the health centers to avail of these vaccines. So we're currently, all throughout the year, it's not anymore a seasonal thing. We go on a massive information dissemination. We even have projects to ensure that the senior citizens really come in, and maybe learning from the pandemic, we're now tracking all individuals. We're creating a database for all these individuals so that we will be able to see who were vaccinated, who were not vaccinated, so that we will be able to track them better. Now, in terms of the healthcare provider, I think it now becomes automatic for hospitals to mobilize their infectious control committee if there are changes in let's say, levels of alertness in terms of addressing COVID or influenza. But for the health centers, I think it's a different perspective in as much as we deal directly with the community. And first hand or first off really is education. And there were two approaches that were quite different learning from the COVID. One is to address the issue through our educational system, to the DepEd, so that the children themselves are educated that they need the vaccines. And number two, they are the ones that facilitate the education of the other members of the family to take the shots. Otherwise, they would be most affected. And of course, for the senior citizen, we take it from the NGOs and the OSCA, or the Senior Citizens Office for proper education. And these are really their benefits, so they should be getting it really. Thank you.
Okay, thank you very much. One more question, Raymond, before we take questions from the audience. Okay,
Okay.
so again, we have a lot of doctors, nurses who are listening. to this program, and I wanted to ask a little bit about your views on the use of antibiotics. I was reading from one of the articles in China that they were saying that for mycoplasma, they're already seeing some drug resistance of the macrolides, no, azithromycin, erythromycin, etc. So, what's your take on this? How do we balance? How do we balance this now? No, because it sounds like testing is at this point in time not going to be very accessible, given the cost and all of that, right? So doctors will be, as Eric mentioned before our show, uh, using your empirical or your clinical eye to treat a patient. But what are the risks to that? Will we run? Do we have enough antibiotics? I don't know if PhilHealth is covering any of these outpatient antibiotics yet. So I'm gonna ask this question to Jean. So Jean, what is your perspective on this?
Yeah, thank you, Ma'am Sosina. Now, by historical point of view here, mataas talaga ang drug resistance with other neighboring countries, no, with this upper respiratory bacteria like streptococcus and even atypical organisms with macrolide.
Thank you
Mas
so much.
pa nga tayo sa Pilipinas, maganda pa yung ano natin, sensitivity, susceptibility sa Streptococcus pneumoniae with the macrolide, no? But tama yung sinabi mo. Now, in the context of the clinicians kasi, kadalasan sa mga clinicians, pag pupunta sa kanila, ubo-ubo, 3 to 5 days, pinipili nila yan. Tinitingnan namin kung vulnerable population ka ba or itong mga bata, no? Now, if you have a consultation na 60 years old and above or even 50 years old pero diabetic, no? May mga comorbidities, our threshold of giving antibiotic is really very low. Ibig sabihin, bibigyan ka ng mucolytic, sabayan mo rin ng mga antibiotic yan, no? And that's always the case. Now, lately, tumaas itong ILI, kaya nga maganda yung data natin because majority are viral. Ang nangyayari niyan, pag hindi gumagaling, on the 5th day, meron pa rin paubo-ubo, and then bothersome yung ubo, bibigyan ng antibiotic yan, no? At kadalasang binibigay ang antibiotic niyan, it's either a macrolide or an amoxicillin, co-amoxiclav, no? And then usually nawawala yan after 3 days, no? But siguro we need to more vigilant about prescribing kasi kung makikita natin dito, kung halimbawa most of these are not really pneumonia but an upper respiratory tract manifestation, hindi kailangan ang antibiotic eh. Kaya nakikita natin ngayon na talagang there is always overprescription of antibiotic even in a patient without a pneumonia and presenting with an upper respiratory tract infection. Malaking bagay ito dahil this will really impact the drug resistance in the next few years, no? Dahil sa dami ng mga ILI, halimbawa, we have 4,000 ILI, lahat yan naka-antibiotic yan. Ano mangyayari sa Streptococcus sa Haemophilus natin in the next few years? We might be the next China, we might be the next Japan na taas ng macrolide resistance with Streptococcus pneumoniae, no? So I think paalala natin sa mga clinicians natin, be vigilant about giving antibiotics. So sa tingin nyo, it's just an upper respiratory tract, sore throat, pasipon-sipon, it's not antibiotic. It's just have to tell them rest and they will be self-limiting course, no? 8 days, 9th day, mawawala yan. Don't be hindi kaagad antibiotic ang sagot sa mga ganitong klaseng sintomas.
Thank you so much, Jean. Okay, Raymond, you want to take up some questions from the? I saw some in the chat and
There are
also,
some in the chat, Dr. Susie.
And also in the Q&A.
In the Q&A. Okay. We'll pick it up po muna dito sa chat. Question would be, are there any, I'll paraphrase, this is for you, Eric. What are the plans for additional doses of the updated vaccines, sir? Is that something that's in the pipeline? Will they receive it?
Okay. Right now, the bad news is that we have run out of the bivalent COVID-19 vaccine. The good news, if this is a good news, is the FDA has given a certificate of product registration for the Pfizer's bivalent vaccine. We're still waiting for other companies that produce newer vaccines for their applications to the FDA. Except that for the next 5 years, this will be available in selected pharmacies, and this is not free. You have to pay for them. Now, we are waiting for more donations if that even comes through before the year ends or the start of 2024. And as soon as we receive them, our Secretary of Health made a commitment that this will be given only to the most at risk. And as Dr. Jean Solante said, this will still be the senior citizens. And for newer vaccines, because even if we had donations for the bivalent COVID vaccines, we don't have the newer monovalent vaccines, and the manufacturers are getting ground on producing more versions because of the mutations they have observed in the strains related to the Omicron lineage. And so we are looking into the future that aside from newer COVID vaccines, there are polyvalent vaccines that will combine COVID-19 with influenza and then the respiratory syncytial virus. And I have to explain the way that we recommend this. We have expert advice. We weigh the evidence before we give recommendations or even get these vaccines. Thank you, Raymond.
Thank you, Yusek Eric. Additional follow-up question would be any efforts to prevent I think entry and spread po ito of drug-resistant infections like Mycoplasma pneumoniae.
Raymond, it's really difficult because right now, antimicrobial resistance is in itself, not only for respiratory pathogens, a growing public health threat. That's why we have several programs that involve the following: making sure that clinical practice guidelines that limit the use of unnecessary antibiotics for several conditions or illnesses. Number two, in hospitals, that they have to establish an infection and prevention control committee so that they can actually regulate the use of antibiotics. So there's a tier approach so that not everyone can actually use an antibiotic if they don't have the green light from this committee. And number three, we make sure that these medications are tested for any resistance against the most common pathogens so that the treatment is actually guided. And number four, self-prescription should not be a behavior that's propagated, and that patients and all of you watching this broadcast should know better that antibiotics should be completed for the entire course. You just don't take a pill and say that it's over when the symptoms are gone, because this can contribute to more problems in terms of drug resistance. Over to you,
Raymond.
Thank you. Yes, City Ad. Go ahead, ma'am.
Yeah. Additionally, if you would notice, the antibiotics that were mentioned were part of the consulta package. So supposedly they are all free and provided for individually. So I think what is the rate limiting step here is for the physicians to ensure that they follow a certain clinical pathway and adhere to it. Otherwise, we will really be encountering problems in terms of resistance because the meds are available. It's the evaluation of the doctor and the prescriptions that are quite important. Thank you.
Thank you,
Rachel,
Dr. Christia, for pointing that out. Sorry, Susie. Okay.
yeah, go ahead. No, there are a series of questions here from one of the audience, Kai Doring, about excess deaths, no? And I think I'll just say a few words about that, and about having more critical people on the show. There is a team of us that evaluate who will be invited to speak on Stop COVID Deaths. And we really look at credentials, we really look at credibility, because it's very easy for anyone to be critical on social media and say, make all kinds of claims, but these claims cannot be verified. Now, there was a lot of fuss over what were called excessive deaths, when in fact, and we had this discussion with the World Health Organization, there is what we call a method for computing for what we call excess mortality. And it doesn't mean that people died without an explanation. We use excess mortality as a technical technique when you're looking, for example, at deaths from heat waves, right? People don't drop dead right away. They die after a month or so. And so there is a formula for calculating for excess mortality. And I think this has been taken out of context. So I just want to reply to that, because you've got a number of comments on the chat box. And I don't want the audience to have the impression that we're avoiding this topic. We're not avoiding it. We can, in fact, talk about it. But the way it has been portrayed is that these are deaths among people who were vaccinated. No, that's not the way this goes. Excess mortality is a particular statistical formula that is used to see and compare one period of time from another period of time and look at specific factors. And the example I want to use is heat waves, because that's the way we compute for deaths from heat waves. So we're not avoiding anything here. And I also want to say that we cannot just bring on board anyone who wants to talk and criticize, because this is
Susie?
light. Yeah, go ahead.
Okay, on point, and I'll just to add, excess deaths is about all-cause mortality.
Yes.
And there are articles that have already been published, and in fact, it has estimated and calculated the estimated deaths for all countries in the world. And for the Philippines, surprise, there are no excess deaths from the pandemic period. In fact, when you look at excess deaths, please don't relate it to deaths due to COVID vaccine, as what Susie would pointed out. Please learn what we really mean by excess deaths. This is an important indicator because it easily flags our health system if it's functional or not. It's related to that really, and not to these vaccine injuries or anything that the purveyors of fake news actually want to impress. Please check your sources, and I'll be glad to share with you articles on excess deaths. Thank you.
Thanks so much for that, Eric. Okay, we have time for one last question, Raymond, on back to our topic. Back to our topic, and then we'll have to close our program because we're running out of time. Go ahead, Raymond.
Sure. Baka may comment lang si Dr. Solante, baka may idadagdag siya.
Gene. Meron
I see him chomping at the bit. Sige, okay po.
Sige. Go.
I highly appreciate the comments of Doc Eric and Christian regarding excess death. And probably on that take siguro, kung makikita ba natin, because I saw this data rin coming from the Philippine Statistics Office ba yun, yung nirelease nila na mataas daw yung mortality. So if you look at those deaths, again, Ma'am Susie, these are death secondary to non-communicable conditions like ischemic heart disease, stroke, and malignancy, And we know that during the COVID-19 pandemic, when we had the pandemic, a lot of these people does not have the luxury of consulting doctors. Their maintenance medication was also disrupted. So I think that's partly because of the altered healthcare system during that time, focusing on COVID. Kaya siguro we experience it in the ground. Maraming nagka-stroke, maraming nakikita namin ngayon mga malignancy even in younger population. So I don't see any correlation or something na parang meron bang alarming na nangyayari. Most countries also experience the same dynamic of why excess death was observed. Yun lang po.
Okay. Raymond, last question.
Last question, I guess, would be well, progress on vaccines for children below 5 years old.
Yun, magandang
For
question.
for this is from Rosemary Santiago from the chat, from the Q&A box for Yusef Tayag.
We have not adopted the recommendations from the CDC in the United States. We have limited our evaluation on available evidence, and there are expert groups that give us their recommendations. We evaluate it again. As soon as we have new evidence, then we are going to introduce such vaccines. But for now, we are not. Thank you.
Okay. Okay. I think, Raymond, we have to go now to our fun quiz. And then, yeah, we're going to give our speakers a few minutes to formulate their final messages for us. So go ahead, Raymond.
Can we have the Zoom poll po on the screen before we... There we go. Okay. So, kung nakikinig po tayo, ang medyo madali po nga natin. Ang first question po natin, ILI, what does it stand for? So, 88% of those who participated at least in the Zoom chose letter B, and then here 83% po sa ating Slido. So, that's the correct answer po. Letter B, influenza-like illness. For question number 2 reads, which of the following are recommended for households po na may flu patient? So, thankfully, marami po nakakuha. And then, 95%, those in the Zoom, chose all of the above. Dito naman po lahat po sa Slido, nakakuha po ng tamang kasagutan. Okay? So, can we also have on the screen our evaluation poll po na will give a few more minutes to our speakers to formulate their final words to the audience. Here, you'll be able to see 5 questions po for a 4-point Likert scale. Panel discussion poll. Wala po kami hiwalay na sinisend out dito po sa evaluation poll na ito. Ito na po iyon. So we encourage everyone to participate po and put in their comments and assessments po for this webinar. So I'll read and then we go to the final words po. Number 1, the panelists demonstrated through thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language or technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this panel discussion poll until the end of our webinar as we move ahead with the final messages from our speakers. Dr. Susie.
Okay, thank you very much. We'll start with Christia. Doctora, please go ahead.
Yeah, as healthcare providers, let's first take care of ourselves. Let's be the best examples to our patients and to the community. The community are relying on us for correct information so that we have a healthier life. So, Merry Christmas.
Thank you very much. Okay, Jean.
Yeah. First of all, I would like to thank Ma'am Susie, Raymond for this invitation and opportunity to share also some of the thoughts that we have as infectious disease specialists. Siguro ang ano ko lang dito, don't panic, no? We are in good place now compared to the previous years. Yes, ILI is increasing, but we see these cases several years ago and we still continue to see this. So siguro, we just have to address ano ba yung pwede nating ma-prevent, and that has to do with vaccination. No? So we still encourage people to get vaccinated, flu, pneumococcal, and other vaccine preventable or vaccines that are available for the age group and for the vulnerable population. Maraming salamat.
Thank you so much, Jean. Eric, go ahead.
Okay, maraming salamat. As announced, this is the year-ender for Stop COVID. But please, don't end the year with getting COVID. Sa Healthy Pilipinas, bawat buhay mahalaga. Maraming salamat po.
Maraming salamat, Undersecretary Eric Tayag. And thank you to our guests.
Thank you
Naku,
so much. Yes po.
I'm very, very grateful for our experts who find the time, prepare the presentations, and actually are able to deliver and articulate very clearly to our public and to our regular listeners of Stop COVID Death the key messages. But we have more, like a bit of a summary. Raymond, you want to introduce our
Yes, we're very fortunate po, and Ma'am Stella, thank you po. Please take the time out to visit your relatives po, no. But today we have a special guest po who will be delivering our synthesis and closing remarks. You notice we have preference for the Department of OBGYN at the Philippine General Hospital. So she's the chief naman po of the Division of Family Planning, Dr. Joanne Karen Aguinaldo. Ma'am Joanne, go ahead.
Thank you. Thank you, Dr. Raymond. Masunurin po kasi kaming lahat ng mga OB. Di ba, Ma'am Kristia? Masunurin kasi kami. Boss ko rin po kasi si Ma'am Kristia before. On behalf of Dr. Estela Jose from the Office of the Expanded Education and Training, maraming salamat po at congratulations sa kay Dr. Susie and Dr. Raymond, and of course the team of DCUP, of TVUP rather, para po dito sa Stop COVID webinars na ito na is still continuing, is still relevant, and is really discussing timely issues. So for today, allow me a short conclusion, because our panel did so well. They actually summarized their points towards the end. Our topic is kung may trangkaso ka ba at ano ba ang updates tungkol sa COVID-19. And I'm also very reassured by Dr. Tayag's presentation, because he showed us that the DOH is keeping track of all in particular the trends of respiratory illnesses. And this seemingly reported increase in illnesses that we are finding is just it follows the seasonal trend. Tama na po, Dr. Dayag. And it's not does not indicate that there is a new virus or that we are heading towards another pandemic. And in fact, he shared with us that there are 50% less influenza-like illnesses this year compared to last. And that COVID-19, while there are some still new cases per day, it has a very high recovery rate, 98%, and a very low mortality rate. And then Dr. Jean Solante very ably presented to us some updates about the COVID-19 variants, which I pick up that COVID-19 from his presentation. I pick up that COVID-19 is still here and will likely is here, actually, not still here, is here, and will be causing new infections, and there might be peaks because it is part now of it can coincide with other respiratory illnesses. But it seems that in what he presented, the ICU to hospital ratio, my takeaway is that it's not as aggressive as before. It's not as worrisome as before, but it is still an illness of concern and must be surveilled, as what the DOH is ably doing. And the trend is for variant-specific vaccination in priority population, which is also what the DOH would like to do if the vaccines are rolled in. And of course, from Dr. Padolina, we were able to hear what is the mandate of the LGU, which is really to educate with the right information. And she has showed us the ways and their infographics, which very clearly describe the preventive strategies, not just for COVID-19, but for all respiratory illnesses, and the mandate of reassuring and giving situational reports, accurate situational reports, so that your constituents are not inordinately alarmed. And from the Q&A, we pick up that this may lead to, and of course, our indiscriminate practices, not naman indiscriminate, but our practices in being very over-prescribing antibiotics may lead to drug resistance. So medyo relax din tayong mga physicians, no? Pwede rin nating i-reassure ang ating mga pasyente, at hindi naman masamang magsabi na pwede naman talagang uminom ng maraming tubig, magpahinga, mag-hand wash. Pwede namang yon ang ating ipayo sa kanila, at hindi lang kailangan prescribe ng antibiotics right and left. And of course, we have to be guided by clinical pathways. So that's it. Maraming salamat po ulit at I'm very happy to have listened into these listened in today and be in the audience with this esteemed panel. Thank you, Dr. Susie, Dr. Raymond.
Okay, thank you so much, and we hope to see you again. To do a synthesis, love your
Yes.
synthesis. Okay, Raymond, you want to give the results of our evaluation?
Sige po. Thank you so much, Ma'am Joan. For our evaluation po, no, very high, between 94 to 97%. Strongly agree with the statements here. Again, testament po in the quality of our speakers as well as the topic at hand. So, thank you so much again to Undersecretary Tayag, to the President of the Philippine College of Physicians, Dr. Ronjin Solante, and City Administrator for Navotas City, Dr. Tricia Padolina. Okay, so since ito na po yung last natin, at least for 2023 po, no, magkikita po tayo next year naman, January 19th, third Friday of the year. So we hope you'll take the time out for the rest of the holiday season po to rest and meditate po and really just mag-ano lang po, mag-share lang po yan. Okay.
Very
Thank you
good.
so much. Very nice, very nice. And happy holidays po.
Very good.
Sa lahat-lahat.
January 19. Okay. Wait, pero pag ganon,
Siyempre, full of thought na mapupunta sa gitna si SOH, Dr. Susie. Thank you so much. And before we conclude po our program for the year, All Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. You just open up your app, your YouTube app po, no, and you go type TVUP PH and you'll be able to go to TVUP po na channel. You just go to the live tab and you'll be able to see all 175, after today, 176 webinars na po yung nakalagay po doon. Also, yung ating po ICD shorts ay mapatagpuan din po doon. Very, very small, short, and the consumable po ng videos is in the same YouTube channel for TVUP. So this formally closes our webinar po for the week. Magkita-kita po tayo again next Friday from 12 noon to 2 p.m. It's a date.
Okay, before I say my closing line, I just want to remind everyone, we won't see you until January 19. Wag na po kayong gumamit ng paputok. Let's not have any injuries. With our merrymaking, siguro pwedeng mag-videoke, mag-torotot, other things. Pero please, iwas paputok. Okay, so together we can stop preventable deaths.
So keep safe.
Susi, sumayaw na lang tayo.
Ayun!
Pwede yun.
Correct, Eric.
Sayaw.
Tama yun. Pagsayaw na lang. Yun ang sayaw natin. Oo.
Thank you, Yusek, Eric. And so keep safe, everyone. Keep healthy and see you online.